So Dr. Rahul has joined us. So I'm starting a session now. So let me start with this session with a greeting to you all. So good afternoon, everybody. And thanks for being a part of this session. And I can see all the attendees who have joined us from the different part of the country to be the part of this session and gracing us with their presence. So as you know, we have a session today, case study beyond hysterectomy. I am Dr. Isha, your moderator for today's session, and I'm delighted to be here amongst the passionate practitioners who believe in the depth and power of classical homeopathy. Today's session will promise to be a rich learning experience as we have explored the beautiful documented case of ovarian cyst and multiple uterine fibroids that has been managed by Dr. Rahul and Dr. Dhanashree. Before we start the session, let me give you a brief introduction about our speaker, Dr. Rahul Jadhav. He needs no formal introduction to most of you. He is a leading classical homeopath practicing across Satara, Karad, and Pune for over a decade. Dr. Rahul is deeply admired for his authentic classical approach, sharp clinical insight, and a teaching style that blends with clarity and inspiration. He has been invited to conduct multiple seminars and workshops in several cities, including Amravati, Belgaum, Dapoli, Satara, Chiplun, Latur, and Pune, each time leaving all the homeopaths inspired with his deepened practice. Many describe him as a true motivator and guide. So without taking much time of yours, let me welcome Dr. Rahul and grace us with his beautiful case. Dr. Rahul, good afternoon.
Thank you so much, Dr. Isha, for your warm introduction. Okay, I'm very grateful to be here. Thank you so much for RadarOpus, the software which we are using since our college days. We have all the more than 15 years regularly. Rarely a day passes in my life without using this radar. Not at all. I'm not promoting or this is not a commercial, but I'm telling very truth. And there are so many new additions nowadays, and let's see how I will be utilizing this in this case also. So without wasting a single minute, let's start with our session. Actually, today's heading is given Healing Beyond Hysterectomy. Okay. Now, as many of you, those are attending, know that we are conducting this case study series. Like in every month, I present well-documented case, and we have a group which is now more than 600 sincere homeopaths. They analyze on this case. Now let's talk about today's case. So the heading given for today's case topic is Healing Beyond Hysterectomy. Nowadays around us, there are so many cases that comes to us who are potentially asked for surgery. This decision is many times very dicey. They go for almost always they go for the second opinion. Okay. Now, even in developed countries, getting appointment of a surgeon is also not an easy task. In India, once we plan, we can get it easily. But in developed countries, they take 3 months, 6 months usually for the getting appointment of surgeon. Now, this period is very useful and can be utilized effectively by homeopaths once you know that in such case how to proceed. So either it is tonsillectomy, or it is hysterectomy, or sometimes even it is appendectomy. There are so many cases that we can save patients valuable money, even the amount of money cost, and even the operation cost, and bad effect of anesthesia. There are so many things. Okay, so let's focus on this case. Interestingly, I just remember I had another presentation where I had focused only on this. So in 2 minutes, this is just what I remember right now. In 2 minutes, I'll show this. So I will devote few slides to this. Surgery is sometimes necessary, but not always. Many conditions labeled as surgical can respond beautifully to classical homeopathy. With correct individualization, we can avoid surgery, save cost, and prevent anesthetic risk that just I was talking about. And in many countries, waiting for surgery takes months. Homeopathy can help such patient in this waiting period. So these are few examples. So we are not dealing today with a single case of hysterectomy. I am presenting before you a wide spectrum, a precise, we many times ask what is the scope for homeopathy. There are scope and limitation. There are limitations also, of course, but remember, homeopathy has survived, not only survived, but flourished for more than 200 years, starting right from its in its discovery since in the 17th century to more than 200 years now. This is due to these areas. Okay, so right now we are only exploring one important area, that is avoiding unnecessarily surgical interventions. So these are some of the conditions. You take fibroids, tonsils, renal calculi, piles and fissures. Everybody must have cases from us. Gallstone in selected cases, and even chalazion, abscess, fistulas. These are the areas where there are documented. If you see the literature in homeopathy, it is filled with many such incidences, right? So advantage of classical homeopathy, we avoid unnecessary surgical trauma. Of course, it is economical. It strengthens. I'm talking very quickly because we are going to the case. Believe it or not, I just remember this about this presentation and I'm presenting you. Okay. Prevent recurrence, and of course, gentle, safe, and suitable for all ages. Now, clinical success and experience is important. Thousands of cases worldwide show surgical disease cured by constitutional remedies. Now, long-term follow-up proves sustained improvement. For example, it is from my practice that adenoid child avoided surgery for after 3 months of remedy calcarea carb. So there are remedy can be anything from calcarea carb to Merck sol to Sinapis nigra, like rarely used remedy. But yes, it is possible. Okay, so the important line is, let us heal before we cut. Okay, so this was the short exploration of the same topic. Now let's come again to the earlier topic. So now talk about this female. See, in the modern medicine, when the research is done, what they usually do, there is a trials, single blind, double blind trial, clinical trials. Then they post about tens and hundreds and thousands of cases, and they then come to the conclusion. But it is very obvious that in homeopathy, this is not always possible because we have individualized approach. We cannot present 100 cases of fibroids with calcarea carb and surgery avoided. This is not a homeopathy because this is not an individualized approach. In homeopathy, we can always go from the case to the remedy, and then we can teach you the remedy. That remedy, same remedy, can be applied in 100 other cases, not only cases of like in this context, hysterectomy. Okay, why I'm telling you? Because I'm not just telling today a case of hysterectomy, but I'm giving you the idea, the portrait of a remedy which you can effectively apply, as I have told you, from today or tomorrow in your clinic. So saying that this is of course not a rare remedy. Rare remedies are rarely used. Even in, I have been to the very well-known modern physician like MD medicine here. He also said that rare diagnosis comes rarely. So always look for uncommon presentation of common diagnosis. As he says in his context, diagnostic context, always look for uncommon presentation of common diagnosis, then common presentation of uncommon diagnosis. For example, a same malaria typhoid in their context can present to them or us in different pictures. Similarly, what we are teaching here is a day-to-day remedy with all its angles. I hope you have got the topic clear. Now, quickly I'll read. I hope many of you have already read the case. So this is 40-year nurse. Now, how she came to me basically. So there are many doctors, homeopath students who come to my clinic for observation, and on other time they work in the hospital, like doing night duties, like houseman. So this lady was a hardworking sister nurse in the hospital, and because of this complaints, irregular uterine bleeding complaints, she has been into the stress, because many gynecologists, two gynecologists already told that you have to go for hysterectomy. You have thickened endometrium, cyst, and a few fibroids. Because of that, now you have to choose that option of hysterectomy. Now, obviously, she was unwilling to go for surgery. And then the houseman who was working as a night duty told her that better you go for this option. This might help, because she has seen such cases in my clinic. So patient summary is a 40-year-old female with ovarian cyst and fibroid, obviously advised hysterectomy. Thickened endometrium is also, that was the main concern for them, because from their perspective, it is potentially a precancerous condition, potentially a condition that require biopsy, DNC, and all next steps. Okay, and obviously she was bleeding heavily. So the view of gynecology, see, we should not blindly criticize this modern medicine doctors. Okay, they have put a lot of effort. They have to do MBBS, then post graduation. Of course, we have a better option for patient. But while talking, I have seen some of the students, they get over motivated with homeopathy and started blindly criticizing. That we should also avoid. Once these gynecologists know that you are giving good result to the patient, they will themselves, not only gynecologist, any modern medicine. From my personal experience in my city where I practice, and I have gynecologists who are themselves coming to the clinic, sending the patient, dermatologists themselves coming to the clinic, sending the patient, MD physician on their letter pad. I have said in the group also earlier that on their letter pad, say that this is a case of IBS, please manage homeopathically. But remember, this referral letter has not came on day one. It has came after 10 years of patient silent efforts, giving them result, showing them result in nearby cases, and then the day arrives. So initial practice, better respect them, keep on doing your work silently, patiently, persistently. Definitely they will arrive that they will start respecting you. Okay, this is just kind of warm motivation for you. Coming back to the case, so irregular PV bleeding since 6 months, bleeding 7 to 8 times. So that was the concern. Gynecologist saying, if you keep on bleeding like this, you will get anemic, your health will deteriorate, you can't work, and actually that was seen also. So bright red blood with clots, aggravation by motion. So these are some of the modalities we take. Some of attended, like Rina has posted irigeron. So these are the remedy. It's a good option, irigeron. We'll talk about that. But this irigeron, hamamelis, millifolium, phosphorus, these are the bleeders. Okay. Now, if you want to catch this bleeder remedy, you just can't neglect the chief complaint. Nowadays, with surge of mind method, so-called mind method, which we'll definitely talk about. Unfortunately, students are not very keen to take chief complaint in detail. But mark my words that this is one of the worst mistake you can do. Please take the chief complaint properly. Yes, you can prescribe on the mind, on the observation, how we enter in the clinic, how patient call you. These are very important observation. But saying that, you cannot underestimate this exploration of chief complaint. I hope you are getting this points well. Yes. So she described it with bright red blood with dark clots, 7 to 8 pads per day, bleeding, aggravation by motion, worse during daytime, better at night. Many of you already gone through the case. I will not waste time here. Okay. Now, how it started, already she is doing heavy work at the hospital since last few months. It is even increased. There was, I think, epidemic of dengue, like viral, not clear dengue. It was a mixed infection, confusing. the doctors in Pune, Satara, and nearby areas, because after COVID vaccine, you must have experienced that this viral infection is giving some mixed picture. Okay, it is not again clear-cut classical diagnosis. So the hospital are again flooded, and in that epidemic, this hospital was having a good number of patients, and she has worked hard at that. There was bleeding, which is frequent and irregular. In the June 6, squatting for a week, 15 for 7 days. Okay. Now again, gynecologist, US ovarian cyst, fibroid not written. It was thickened endometrium. We will see the reports also soon. Then these are another some few complaints like acidity, fullness, desire, aversion. Please mark again, very, very important. Sometimes patient makes mistakes, makes confusion in mind. In that way, this physical complaints comes us to rescue. Okay. So take it properly. We have presented more than 50 cases. Those who are with us in earlier cases might have noticed that we have taken it very meticulously. You know, sometimes you feel that this is a kind of donkey work. Should not use that word donkey work, but it is like a clerical work. But it pays you a lot. It helps you a lot. Okay. Now, thermally, she is chilly. In the past history, she has typhoid, married at the age of 22 years, 36 years, she had abdominal pain and ovarian cyst, and no major surgical history. Now, let's go to the patient's life space. So patient grew up in Solapur, youngest among 6 sisters. Her father had been addicted to alcohol during her early years, but later gave it completely. Okay. Now see how her nature. Father was strict, disciplined, but while mother was gentle, warm, caring. Since childhood, she had been occupied with household work, helping her mother and elder sisters with daily chores. She would have get irritated when others work carelessly, but quickly returned to her work without an argument. So this is her nature. She was friendly, talkative, at the same time very shy, not very easy with a stranger, hesitation. Mother often praised because see how mother praised her because she is good at work, responsibly. You know, every household we see like the patient like this. Please post on the chat box if you can see a person like this around you. You know, we are repeating this. We are not only dealing with single case of hysterectomy, but we are dealing with a person whom you can find around you after this presentation even more frequently, and you can apply. So you can imagine a person around you, a joint family, a young girl who works well, who copes up with other very well, but not very aggressive, arrogant, argumentative, but rather soft-spoken, caring, responsible, dependent, helpful. So, you know, Hahnemann has given the portrait of disease. You know how you draw the portrait. In the portrait, you draw the face, eyes, hairs. So these words, with these words, you can imagine a portrait in your mind of this patient. Don't hurry up to fit it into the known remedy you know. Okay. For example, in the group, you know, very nicely everyone has voted for the different remedies. Okay. But again, try to understand what the kind of this person is. We have the reflection of this personality in the Mathematical. Don't worry that. I'll tell you, I'll convince you, I'll show you the rubric. For the time being, just understand how this patient is. Okay. Now, since childhood, she has been occupied with household work, helping her mother, elder sisters in daily chores, would get irritated when others were careless, but quickly returned without argument that I just told you. Okay, this is just repetition. Now, the profession she chose was A&M. Everybody knows that nursing profession. BA, she joined nursing, got married. Unfortunately, husband was doing well in package manufacturing, but after a few years lost his job, after which she became a main support of family. Okay, now from here, she choose not to sit at home, but to go work, struggle for her family and all. Okay, just a minute. Without complaining, she took extra duties, additional shift, even night call. Everybody knows how this, you know, almost every one of us who is attending this webinar might have worked at some point of life in hospital, have been closely observing the life of nurses, right? So imagine, so again, all nurses are not same. There are cheerful, there are shy, there are working, there are complaining, there are someone who is dominating you. You know, they order you what you're doing. You know, I'll teach you this kind of attitude. There are others who are like another shades. So imagine your life experiences and try to correlate here. So she took extra duties, additional shift. Now at her workplace, her reputation is very good. Good in the sense that she's working promptly, hardly, calm, dependable, cooperative. If the colleague is absent or unwell, she just adjusts her duty. There are opposite also, everybody of us know. So stays beyond her scheduled hours without protest. Resident doctor staff often rely on her during emergencies, a reputation of being trustworthy, caring. You know, this job of nursing is really demanding. Nobody is happily comes with hospital. They come with complaints, medical expenses, and disturbance of the schedule of relatives. So in that mental state, patient comes in the hospital, and dealing with them is of course the challenging job. Now this our patient is doing this job with care, trust, calmness, empathy. Okay, now she of course feels nervous and cautious, wanting to make sure every detail is correct. Now her dedication was recognized when she received award of best staff nurse. I had a pic of this also, but not now. She has sent me initially that she was getting this reward in the hospital. Okay, now at home, she managed family with quite firmness, expect discipline from her children, but speaks with affection involvement about their studies and progress. She remained closely connected with her sisters, calling them regularly to ask about their health, sometimes even accompanying them to medical consultation. So from 2021, when she came to me first time, to 25, at least she has brought 8 to 10 of her family members to me, every time calling me in the soft tone, not aggressive, not demanding, not pressurizing tone, coming with them, asking me to send their medicine at time, courier their medicine. Even for the mother, she was, I clearly remember, every time before mother's medicine gets over, she in her hectic duty comes to me and tell that please send his medicine, sometimes pay on her on the behalf of them. Okay, now she mentioned additional stress regarding small plot of land and family. So okay, see, in the Satara city, so I'm from Satara, Maharashtra. I think most of us already know. So outside the skirt of Satara, there is MIDC area. In this MIDC area, her husband, with lot of efforts, has finally booked a home, pay for them, and after paying for them, that landowner started behaving reluctantly, not kept his promises, and started delaying the deal. So this was definitely put a lot of tension on her, financial also and emotional also, because they are hoping to be in new house, but that didn't happen yet. So that was definitely stress for her. Okay, so this is all about the case. Everybody has posted about the remedy. Okay, so with the same seriousness and sincerity, please post your case. Yes, carcinosin Dr. Parshottam Patil from Karnataka. Welcome, sir. Causticum, very good. Carcinosin has been already posted on the group by many of you. Yes, carcinosin is the image that we see. Such kind of lady who works hard, manages everyone. Definitely a good option. Anyone else? Lycopodium, very good. Radhika ma'am, Lycopodium is hardworking, sincere, definitely. But many a times, if not always, we see there is tint of irritability, especially on the closed one. They will not adjust others' duty so calmly unless and until dominated, pressurized, or feel that they can, the one who is administering the duty is dominating to them or do some kind of harm, first of all. Okay. Lycopodium is inner cowardice, which might be even Lycopodium is very harsh to in the hospital scenario, the nursing ward, moushes, all these things that might be visible. So Lycopodium will keep aside for a time being. Anyway, but good try. Cocculus, yes. Cocculus is very, very caring, responsible. In the same way, Cocculus is extremely close. Shubham Khata, Shubham, yes, you have posted Aurum Mur Natro Natrum. Excellent choice, Shubham. It is a variation of Natrum Mur, which has strong tendency to fibroid, where Aurum is combined with Natrum Mur. Definitely good option. Calcarea carp sepia. Shubham, if you can remember, we have posted a case of Aurum Mur Natrum Natrum, very huge fibroid. Okay. Yes. Calcarea carp sepia. Yes. So these are the remedies coming up. Everyone, please pay attention to the chat box. I'm again sharing my screen. So after I remember in the month of June, we started this treatment. Of course, and even in just few days only, her bleeding completely stopped. We will see her video testimonial in a while also. The same woman who had been bleeding almost continuously for months reported that flow has ceased naturally, without any palliative and hormonal aid. She felt light, relieved. In the few days, she experienced brief throat pain. Okay, and I have given her acute remedy at that time. The pain was mild and short-lived. Occasionally, she noticed involuntary urination on coughing. Okay, but it is also less. Now, despite of this all, in the following weeks, the menses returned regularly, appearing once every month and lasting, for a few days only. In this span of 5 years, once she had again recurrence of this PV bleeding in the Diwali period. She's from the Islamic community. So in the Diwali period, when all others like us goes for the holidays, they have given task to do extra duties. At that time, not this year, in the last year, she had slight recurrence, which again managed with the same remedy. So in this span of 5 years, she required 80 to 90% one remedy, which we are talking. 10% times when she get acute, she required some acute remedies. Okay. Of course, she visited gynecologist and she done reports again, and doctor expressed pleasant surprise that what you actually took, and like this, the expression which comes with similarium. I hope in everybody's practice this is prominent, not only me. Now, okay, this is again long-term follow-up. She's better. See, all the reports are right now in front of you. Okay, so these were initial reports, you can say, in the month of June when she came to me. Very, very thickened endometrium. This is a matter of concern because this is considered as a pre-cancerous. Okay. Then as soon as treatment started in the month of October, it has all reduced to the 1.21. Just a minute. So it was initially 14.6 millimeter, then 1.21 centimeters, means 12 millimeters to 7. So 14 to 7 on the period of like few months. Then ovarian cyst is also reduced, bleeding reduced, fibroid it was small single initially, now small multiples are still seen. So fibroid has not enormously increased, but yes, fibroid are still there. It is not completely vanished. Fibroid are like lipoma. Okay, so we should not keep unrealistic expectation. These are just growth, overgrowth. But it is not in centimeters, it is few millimeters. And even in the latter reports in gynecological, they do their own sonography. In that reports, fibroid size was also reduced. So again, you can see the endometrial thickness over the period. First report, second report, the same one. So as the endometrium lining is decreased, indicating that restoration of hormone balance, cessation of proliferation, and resolution of pathological basis of bleeding. So actually, as this endometrial thickness reduced, the risk of hyperplasia was almost gone, abnormal bleeding. And actually, that is a serious reason for hysterectomy, hyperplasia and abnormal bleeding. Okay. So we call it as DUB, we call that as abnormal uterine bleeding. These are the clinical terms. Okay, again, same. Oh, so we have the reports from gynecologists, in the initial, you can see here, there are 2 fibroids seen here. They have reported fibroids with down arrow. Okay, down arrow means decreased. Fibroids is decreased, complaint is decreased. Now we'll see quickly a video follow-up of this patient and we will go for the analysis. We have seen initial version.
डिसेंबर महिन्यापासून गेले. मग तो ब्लिडिंग नाही होत होतं कंटिन्यू. आपला स्पॉटिंग व्हायचं फक्त थोडा थोडा थोडा. पूर्ण स्टॉप होत नव्हतं. पूर्ण स्टॉप होत नव्हतं. त्याच्यानंतर परत जुलैमध्ये
if you can't understand Marathi dialect, at least you can understand few words that she is saying. Irregular, okay, spotting.
परत एकदा प्रॉब्लेम आला परत गेलीच नाही. इतकं ब्लिडिंग होतं तर प्रमाणच नव्हतं. मग कदम मॅडमकडे गेलेले. मग ते सोनोग्राफी वगैरे केले. ते अर्जंट हिस्टेक्टॉमी करायला लागले.
So she's saying urgent hysterectomy karayla lagel means you have to go for urgent hysterectomy. That was a word from gynecologist. They know that she is a nurse working in the hospital. They know that her, because many times their patients are admitted. So this was not a commercial advice. Sometimes they unnecessarily give such kind of advice. Rarely, not all of them, but yes, these things happen. This was not the case in this patient.
मग ते सोनोग्राफी वगैरे केले. ते अर्जंट हिस्टेक्टॉमी करायला लागेल असे म्हणले.
असं सांगितलं होतं अर्जंट मध्ये कधी
1-2-4 दिवसात करायला लागेल.
few days you have to go for that.
रिपोर्ट्स वगैरे करा मग हे करून टाकूया असे म्हणले.
त्याच्यानंतर जुलैमध्ये आपण आपले उपचार सुरू केले.
मग मी जुलैमध्ये.
So in the July we started this.
गेले स्वतः मॅडमकडे. जुलैमध्ये ते म्हणले काय गरज नाही हिस्टेक्टॉमी करायची.
So she went to another gynecologist, then another, then third one said that yes, we can wait, and she has given him her medicine. But what happened after the medicine? Let's hear. So after taking medicine from the third gynecologist, still she was bleeding badly and came to me.
आपलं उपचार सुरू केल्यानंतर त्यात काय बदल?
तिसऱ्या दिवशी मला.
So she is saying again third day she noticed change.
ब्लिडिंग कमी आला तिसऱ्या दिवशी ब्लिडिंग कमी आला. नंतर आता जुलैपासून कंटिन्यू मला महिना येते.
महिन्याच्या महिना means she is saying it is coming monthly since then.
ब्लिडिंग वगैरे काय होत नाही. 3 दिवस नॉर्मल
ब्लिडिंग होत नाही. नो मोर ब्लिडिंग.
काम वगैरे करू शकता तुम्ही. झोप
आहे.
Ask about appetite, sleep.
आपण सोनोग्राफी केली.
So while taking this testimonial, we had done ultrasound again. She is describing the things mentioned in the USG and gynecologist opinion.
गेल्या महिन्यात केली सोनोग्राफी. जरा युरिनचा प्रॉब्लेम होत होता म्हणून स्वतः मॅडमकडे सोनोग्राफी वगैरे केली.
So she has some urinary issues like incontinence. I have mentioned in that also. So that was also concerned. So initially I was requesting her even after 6 months only that please go for sonography, but she was delaying it. But finally after a few months she did it.
काही नाही.
पिशवी काढायची गरज आहे म्हणले का?
नाही. जे साईज होता ते साईज एकदम कमी आलेला.
So she is saying that whatever was size, it is now decreased. There is no more hysterectomy needed.
काही नाही.
पिशवी काढायची गरज आहे म्हणले का?
नाही. जे साईज होता ते साईज एकदम कमी आलेला आहे. काही प्रॉब्लेम नाही.
Okay, even she was willing to come today also live, but she has some duty. I was planning for that. So we'll go to the presentation again. Okay, so I will tell differences. Sepia is definitely more irritable, telltale phase, from the telltale phase to the irritability, extreme irritability on children, not having interest. This kind of caring, loving person is rarely Cilicia. But yes, Sepia. So Dr. Rupali, your option is relevant, but not exactly matching here. Calcarea carp has been told by so many, and calcarea carp is the remedy that is complementary to this remedy. Calcarea carp is caring, calcarea carb is responsible in the complete repertory, responsibility taking too seriously, or is for 3 marks in complete repertory, responsible, not in synthesis repertory. But will calcarea do so much exertion, actively, energetically, agile, moving from here and there? She's like thin lady. So this is the only difference. Yes, calcarea carb is a prominent remedy for bleeding from fibroid. Calcarea carb has bad fibroids, bad bleeding. So calcarea carb is close, but the difference is on this point. Yes, anyone more? So again, first time we have answer from Dr. Rupali. Okay. So yes, you are right, Dr. Rupali. Yes, Dr. Malini madam, warm welcome to you. Dr. Malini madam is a respected gynecology teacher in our college. I'm very happy that you have spared time today, ma'am. And madam is teaching gynecology very, very practically, enthusiastically, and student also enjoyed this a lot. Yes, ma'am, phosphorus is the very closest remedy here. Phosphorus is the personality which is caring, loving, which has empathy for other, which thinks so much about other. But there is one difference, that sometimes or many times the empathy or sympathy of phosphorus has a tint of selfishness, many times. So it comes in the hypocrisy rubric. They want to show off. There is more of a portraying themselves as a glowing, charming, glamorous image than a true care, genuine concern. So this is the where we cross with the phosphorus. Okay, so very good. I'll go to my screen now and proceed further. See, we want a remedy which has an action on female genitalia, uterus. So in next 1 hour, we will be understanding this remedy so clearly that you will be applying in your day-to-day practice. That is my commitment. Please pay attention, and definitely we will take all the questions at the end. Okay. So we want remedy which has action on female genitalia, uterus, ovaries, menorrhagia, excessive and irregular bleeding. At the same time, we want a person, a lady who is working hard, who has repeated ovarian cyst, history of typhoid, and thermally chilly. Okay, so he's industrious, you can say, workaholics, want to be busy, very hardworking, family oriented, full of care, exactly like some of you told that phosphorus, cocculus, yes, they come in this category only. So your thought process is right, but we have to consider both sides, like mind and body. Okay, so there is desire for sweets, pungent modalities like aggravation, exertion, and all. So thank you for wonderful participation. Basically, everybody has tried hard for the analysis. As I can show my screen, so I will take liberty of showing how people, group members work. Can you see my WhatsApp, Krisha?
Yes, it's visible, doctor.
Yeah. So you can see these are the list of remedies. So this is way, calcarea carb, kali carb, like podium. 80% of time, many of us, our group member, crack the remedy. So again, please don't be much obsessed with the striking right remedy. I have posted on the group also. The thought process is important. I'm presenting this case, but many times, more than 15 times even, I have to change the remedy also. This is not my monopoly. So don't get disheartened, don't get discouraged. Please try to understand the logic. So this is how, these are the who has participated in the discussion and meticulously analyze the case. See, this is the beautiful totality. Dr. Vishal, see, you can see all the symptoms. So please imbibe this habit. Arsenic is also very close here. Dr. Rahul More, ma'am from Pune, general practitioner, but have a lot of enthusiasm for homeopathy. Okay. Now I will go to the presentation again. So the remedy I used here was Rustox. Okay. Please don't get surprised. I have told you that you will understand next 1 hour why Rustox here. So you see repetition calcarea is coming first. So those who are with calcarea and phosphorus are extremely close here, and even arsenic. So anxiety about children, of course, there was incidences of financial loss, right? So elements from losing money, which has triggered this, disturb her hormonal balance and resulted in the PV bleeding. Menses copious, milk desire, bright red, and of course chilliness, cold aggravation. We have so many beautiful rubrics related with the PV bleeding in the Rustox. This is not related with this case alone. I am telling about Rustox and its action on the female genital. Okay, so you have bright red, clotted, copious between the menstrual period, exertion after intermittent flow, even ovarian cyst. See, for the ovarian cyst, you have only 16 remedies in the repertory. In that 16 remedy, Rustox is for 2 marks. It doesn't mean that in every case of ovarian cyst, you should give this out of one remedy from this 16. Of course not. We see so many PCOD cases nowadays. We should ascribe that to a miasm and match miasmatically. I think you are getting my point. But at the same time, you should know very well that at least which 16 remedy has good action on the ovaries. You can't just neglect them. Okay. So ovarian cyst. So let's study this wonderful remedy. So let's start the interesting journey of understanding the living image of Rustox. Everybody's ready? Excited? Please type in chat box. You are attentive, because a lot of efforts has been involved in creating this all from different resources. So please pay attention. Your every query will be answered at the end. Okay. So what we know from our college days about Rustox. Rakesha, presentation is clear, right?
Yes, Dr. Rahul, it's very clear. And I just, before you start, I think Dr. Vishal was the one who guessed it right.
Yeah, Vishal, exactly. He has given right. Dr. I think someone was also there. Okay. Good, Vishal. Vishal is our team members with us since last almost 10 years. And he is practicing independently in Kolhapur. Very good practice.
That's great.
Okay, so action, see, again, I have told initially also that with the surge of so-called mind method, unfortunately, many of us are missing the physical part, but we should not do it. This is with which homeopathy has progressed for more than 200 years. So it is Rustox is an action on the face, scalp, and genital skin, fibrous tissue, ligament and joint, typhoid-like fevers, nerves and spinal cord causing paralytic effects, and of course glands, which become swollen, hard, painful. So these I have taken from the Phatak. Phatak is an excellent book. I highly recommend. The author is S.R. Phatak. Everybody must be knowing it. He's an MBBS by degree. So he has, eye of an allopath and mind, heart of a homeopath. That's why his written Matra Medica is very useful. Okay. Of course, we know physical important points. Okay, so we are talking since I'm talking since more than 1 hour now. So to make a environment light, I have posted one clip from the movie, which is relevant to this case. Okay, just watch it. And why, at the end, this is just 1 month. Please tell why it is relevant to this remedy. Okay, I hope you have enjoyed this Marathi music. And can anybody tell me that what is peculiar symptom here in the chat box quickly? Relevant to this case, of course. This is 100 crore Marathi movie, which is later remake in the Hindi also. Anyone in the chat box? What is relevant here? Isha, can you read if there are any answer?
Not yet, doctor. I don't see. I think so. Everybody is waiting for your esteemed inputs only.
Okay. Anyone? This is very common. You can, how it is related with the remedy restox. Yes, anyone? Please think properly. The what phase is you develop a thought circuit, neuro circuit in your mind once you start thinking on this line. Okay. So if you open a simple our day-to-day book, that is Allen Keynote, the first line it reads that bad effects of getting wet, especially after being overheated. Okay. You see, he was running from the hot sun in the heat. It is filmed in the draft affected area in the India, in Maharashtra, where there is very scarcity of water, very hot. And he comes and all the way jumps into the water. Nothing about mine, he was looking at that girl, and that was not part relevant to this. Might be, yes, Rastox has a very soft mind, a soft heart, so it can be related. But the main point here was, I will highlight it. Bad effect of getting wet, especially after getting overheated. Okay. Even you can see too much summer bathing in lake or river. Okay, exactly, which is visible in this case. Okay, so please, this don't forget, you can apply it in many cases. Here I will tell you one small case in my city, Satara. So I know I remember there was a COVID rampant in my city, everywhere in the world, and I had one patient who was ECG technician in the civil hospital Satara. Now, as the number of patients started growing rapidly, exponentially, he was assigned the task of office boy, like ward boy. Okay, because ECG was not that much required, and he was kept for duties after duties, morning duty, evening duty. To make matter worse, he was not given any a bed to lie on, that also occupied with patient. Finally he has to lie on the ground, like near ground there was a marble, not marble, there was a cold basement where he used to sleep. After that he got bad respiratory problems, high grade fever, and he came to me in that condition. A few doses of Restox promptly cured her very quickly. He didn't took any, of course. Now her mother was also, now why he came to me, I remember her mother was also having this kind of bad PV bleeding, and her uterus was saved till date with lilium teak. Okay, so of course Restox is not going to help in every case. She was lilium teak because of all her aggression, moods, big clots, an uncommon symptom of bleeding while urination. I can't remember exactly, so that totality was different. So this is about a boy who was working in hospital, help it. So Restox has strong physical symptoms. That is my point, and we have been using Restox as an acute remedy. Like we get sometimes neck stiffness, overtraining, straining, spraining. This is the one part. Now, why we are here in the next 45 minutes, we'll be exploring the mind part. So everybody is ready. Let's see Restox mind part. Yeah. So What do you know about rust ox? Yes, since college days, we have been hearing. Okay, so this is the typical keynote that we have studied in our college days, Dubai, that aconite, rust ox, arsenic is a trioprestin, is a trioprestlessness. It is a true. Even, I think Vishal has initially posted about this case being arsenic. So you can imagine how similar they are, how close they are, even in this case also. Let's go to the next point. We all know that rust ox is very frequently used everyday remedy in our clinical practice. If rust ox is a truly day-to-day polycrest, then its inner essence must be witnessed around us. The people we meet, the family, clinics, classroom, everywhere, even in ourselves. For example, I'll tell you what I want to say. 𝐸𝐸 is a polycrest. There are few people around us who are constitutionally 𝐸𝐸, meaning that their physical, mental, pathological, pathophysiology and mind. Remember this word, pathophysiology and mind. This all, when we analyze it, points toward 𝐸𝐸, and we give them 𝐸𝐸 and it works wonder. Okay. So these are constitutional 𝐸𝐸. But we are medical students. So you can imagine that our exam is coming in next month. Remember our college days, our exam is going to come in next month. So what happens to us? We sit on hours together in some taking some notes, reading some notes, quick notes. We don't move for hours together. Some of us take whole night. They keep on reading, last minute preparation. This is an acute 𝐸𝐸 condition. We take tea, some irregular food. This is an acute 𝐸𝐸 state that we land in. 𝐸𝐸 chronic is different, 𝐸𝐸 acute different. So why 𝐸𝐸 is polycrest? Because in that 𝐸𝐸 like condition, everybody else can enter some part of their life, though we are constitutionally different. Acute 𝐸𝐸, you can say. Similarly, if rust ox is polycrest, we should know that how we can also sometimes land in rust ox. Similarly, for example, you get some kind of sprain, bad sprain, you can be rust ox. For there is a Ganpati festival and you are screaming loudly and overexert your throat. Rust ox is a +3 remedy, sore throat after overexertion. Okay, so this is all the physical. Now let's see about mind. So let us try to shape a clear, reliable, mental, emotional, pathological picture of rust ox in trusted sources like Kane, Phatak, etc. So here comes the interesting part. So I'm not using any of modern Starboard. I'm not using any of so-called metaphor of the rubrics. That is also useful. That is also practical. But let's start from the verified, reliable sources to the newer sources. We'll cover that also. We'll cover everything from 𝐸𝐸 to 𝐕𝐸𝐸, from Sankaran, from mind method to everything. But we will start from the point of Clark. Now, what Clark write? Uneasiness respecting one's children. Is it common or uncommon? Very common, right? Yes. But this is pathological in this state. So try to understand that everything which is given in repertory is mentioned pathologically. For example, in repertory, there is no rubric like happiness. Either there is depression or there is euphoria. These are both extreme state of mind. Stable state is not in repertory, and if it is in the repertory, it is not a normal. For example, in repertory there is positivity. So this is not a general healthy positivity that one should have. This is a pathological positivity. I had a patient who has first child mentally retarded, second child mentally retarded, third child is also unfortunately, very unfortunately mentally retarded, and still she's feeling very positive that her life will be very prosperous. She will be, her son will be performing on the stage. Now this is unfortunately a pathological positivity, away from the reality. In the similar context, we should see that this is an anxiety about children which is little bit more, little bit intensified, little bit aggressive. Okay, then we can count it. Now rubrics. So again, in the Phatak, it is clearly mentioned only remedy. The fear, anxiety, fright about children, only Rostox. Then Phatak's Matra Medica, anxiety respecting one's children, only Rostox. Okay. So Rostox can be best described as, so this is a description that has come from the rubric, come from the mind rubrics, the selfless caregiver. Okay, selfless care. Here it is differentiated from phosphorus, how we will see soon. So these are some of the points that you should remember when you are thinking about Rostox. Someone who has tremendous anxiety about children, at the same time having anxiety, they will not just rest and become freeze like calcarea. Sometimes calcarea has inertia. You know, inertia. In the school days, we have to do one kind of experiment. You know, there is a pot, and on that pot they used to keep some paper, and on that paper there is a sikka, coin. So what happened if you quickly pull this paper? The coin will not move. Coin will not change its position. This is calcarea. Calcarea is inertia. हिंदी में उसको heaviness बोलेंगे या मराठी मध्ये जडत्व असा शब्द आहे. Okay, so it is exactly different from this Rostox, which is on the contrary very agile, very movement, very energetic at the same time. Mild, soft-spoken, anxiety about children. Okay, again. This has a strong religious affection to the point of superstitiousness. Strong worries, anxiety about family. If money. If you see in the rubric, ailments from money loss, there are very few remedies. So if I count exactly, I'll tell you. If you open the repertory, ailments from money losing, only 30 remedies are given. 1-3. In the synthesis, modern synthesis, and in that Rostox is given for 2 marks. So top 7 remedies, top 6 remedy who has very much disturbed from a loss of money are Rostox, calcarea, aurum, arnica, ignatia, and also sarsaparilla, veratrum. Okay, so in that context also, and physically you see sensitive to change of weather, elements from overexertion, of course. So this is a picture. Now we will see each point of this. So these are the points. We will see one by one. Now this is busy and restlessness point. Now we will see this point. Next slide. So how we came to know? See, today's case is not only to save one's uterus. Today's case is also to understand how you can develop a picture of remedy, how you can develop a reliable portrait of remedy from the repertory. So I went to the repertory. I found that this is remedy for busy. Only 11 remedies in Kent repertory for busy. So this is one of the busiest remedy. Okay. Now delusion engaged in some kind of occupation. So you must have remember that in college days we have read the dreams of swimming, dreams of working. So in this context, Rostox is very workaholic remedy. I have collected other rubrics from my new RadarOpus. Okay. So we have all the kind of beautiful rubrics. Busy, delusion engaged in some kind of occupation, delusion swimming, is at hard work, busy, roaming in the field. Exactly, you can see in that video, roaming in the field. Talks of business, restlessness, must move constantly. This is come closer, very closer to the arsenic here. And that's why, you know, some of our student Vishal has initially told about arsenic. So this is on the right track. Now we have covered the point of busyness. Now next point is anxiety about children. Now we will cover in this sense next rubric. So for every point I am giving evidence, justification from the repertory. Okay, not just, you know, a version that I feels it looks like Rostox. It looks like Rostox will stage also come in your life. So it is called as intuition. You know, a patient calls us in a very kind of dominating way. We feel that, oh, it can be a lycopodium, or he can be a veratrum. You know, this is, and then we feel that, then we say, some of teachers say to the student that, okay, I identified the patient from call itself. Please refrain from such a kind of boasting, because this is you know, hurriedness or quickly going to the remedy can sometimes, you know, problematic to you also and patient also, because this is just a version. Okay, so over relying on the mind is different thing. Should not do that. Always match it, combine it with a reliable physical, and then your remedy would be more evidence-based, more clear. Now I was talking about 𝐸𝐤 also. So 𝐸𝐤 do comes, patient comes us and sit inside. I was talking about modern medicine doctors. So some of doctors can identify, oh, this is a case of renal, this looks like a case of renal failure, you know, weak, face is very pale, loss of weight, that exhausted look, he can be of a renal failure, he can be of a typhoid, he can be of malaria. In homeopathy also, he can be 𝐸𝐤, he can be lycopodium. This 𝐸𝐤 is nothing but your practice. You see 100 Naxomica, and then you can identify it easily. So similar way, now your thinking about Rustox will start and you can quickly identify it. Okay. So the point here was about family. You can see beautiful rubrics about family. We have seen beautiful rubric about busyness. Now beautiful rubric about family. Anxiety about family, love for family, fear of killing her child. So you can imagine how they are concerned with children. Cares full of relative. Only 20 remedies. One of them is Rustox. Cares full of course, 107 remedy. One of them is Rustox. Everyone is with me? Yes. Now we will see the third point in that, that is religious affection. For religious affection, I will tell you few interesting rubrics which proves that this is a very religious oriented remedy. Religious affection group is occupied with 82 remedies. Superstitious, 23 remedies. Fear superstitious, how many remedies? Only one. You know, these remedies are called as if there is only one remedy mentioned under some rubric, this is very unique expression of that remedy, and from that rubric we can explore the psyche of the entire remedy. For example, Kali carb, you must have no. Okay, I will open my radar here. Okay. So rubric is company, desire for, okay, and there is sub rubric company, desire for, treats them outrageously. Dr. Isha, can you see my radar screen?
Yes, doctor, it's completely visible.
Yeah. So you can see this is only one remedy rubric. Okay. So now here you can study the Kali carb throughout. So these are the patient who wants the company exactly like calcarea carb, but at the same time keep on yelling on them, keep on irritating on them. You must have you can imagine a typical clerk in any government office. You go with some application, and what they do? You come afterwards. You come after lunch break. So they are constantly irritated by doing same work. Imagine a family person like our uncle, father, you know, who are very much concerned about closing the lights in the home, saving the money, not spending. They keep on irritating, they keep on screaming on us with all the affection. So they want us, at the same time they treat them you know, outrageously, means badly. So this is example of single remedy rubric. The reference here was in same way for Rustox. This single remedy rubric is fear superstitious. So fear superstitious, you should remember this. There are another interesting rubric also which is coming. Okay. Now elements for overexertion, no need to tell you, but please understand that this is overexertion not only with the body. It can cause nausea, it can cause diarrhea, it can cause difficulty, breathlessness, it can cause hemorrhage from lungs, it can cause fever, and it can even cause paralysis. Vice versa, if the patient has a paralysis, if the patient has a fever, if the patient has a hemorrhage from lung, respiration difficulty, menorrhagia, nausea, diarrhea after exertion, you can think of Rustox. Now here comes an interesting part, selflessness. Okay, many of us thought about carcinosin. I respect and appreciate them deeply because here it comes very close to the rust ox. You can see carcinosin and rust ox both are mentioned under selflessness. On the contrary, again I'll change my screen and go to the radar to show you why phosphorus was the issue. So phosphorus is written under hypocrisy. Okay, hypocrisy means see, here is phosphorus. So here is a difference. Phosphorus is under hypocrisy, a kind of selfish attitude which is not evident easily, and here it is selflessness. If you understand this person, this lady, what she was doing for family, she was doing for patients, she was doing everyone who is around her. So this is called as selflessness, keeping themselves at last. Phosphorus want to shine, glamour, to show that, see how cheerful I am, how vibrant I am, how glamorous, helpful I am. So this is a phosphorus. And where it is a true selflessness, exactly like carcinosin, yes. Now fear superstitious, I have told you. So what this fear superstitious is that, first of all, they are superstitious. Superstitious means a belief, a false belief that something might happen which is not scientific. For example, if the cat is crossing your road, something bad will happen. This is what we typically call as superstitious. As far as India is concerned, superstition is, it needs no introduction. There is so much talk about being superstitious, not being superstitious, being scientific. Not our Constitution of India also mentioned that we should develop a scientific attitude. If I talk on this topic more, it will become out of this academic and go to the some kind of political. But yes, as a medical practitioner, we should always support the scientific temperament. Maharashtra, we have incidences where such a rationalist has been killed in the daylight, and still we can't catch their killers, actual killers. My Satara city has a rationalist, Dabholkar, who was killed more than 10 years ago, and still it is not very clear. In Kolhapur, we have another rationalist, Pansare, who was killed. In Karnataka, there was Kalburgi, Gauri Lankesh, that's what I remember. The whole context was not political at all. Please don't take it in other way. But superstitious is pathological. If someone, there was incidences in Pune in this week only that a foreign return couple was looted for crores, not thousands, not lakhs, for crores. Some Baba has promised them that they will cure their daughters. They have two daughters who was reportedly suffering from some kind of grave disease, and this Baba has looted him for crores. They have told this couple that you have a lot of money, and because of money, your daughters are sick. Now just transfer this money. So they kept on transferring, kept on transferring. They have sold house and everything, but there was no change, unfortunately, in the health of that kids, the daughters. And finally, they went to the police. This is the last week's incidents. They were both has house even in UK. So you can't imagine the disaster that this superstition can cause in the life of someone. Now here, this is fear superstitious. So this person is very much superstitious. So it is a typical a mother in our house, mother or some old lady who is very busy, who is very caring, and who is very religious. Marathi त्याला देवभोळेपणा म्हणतात. Faith is different, and superstition different. In the Marathi, Shraddha and Andhashraddha. So there is a very thin line between them, and many times this line is crossed and problem happens. Coming back to the case, these are the summary of these important points. Now even I have taken reference from Dr. Praful Vijayakar. very eminent homeopath, no need of introduction. Now he has also clearly written on the same ground. So Rostock is a meek, timid, very restless, but obsequious. Obsequious means respect giving. That's why somebody might have told about hamamelis in this case. That means giving unnecessary respect to the people, even to the younger people. They are good by heart, very giving, very loving. So this Vijayakar sir's description also matches with our discussion, right? Okay, so typical ideal housewife, if you see the remedies of ideal housewife, natrum mur, cocculus, Shubham has told about aurum mur natrum natrum. So that's why it comes close. Somebody, who has to take care of parents, in-laws, children, and doing all kind of this stuff. Phosphoric acid also has, dancing unconscious, who is studying this mind method must be acquainted with this. Again, balance both. So these are some of the remedies that can depict as an ideal housewife. Rustox comes in this category only. So at least you can know the DD. I have also looked for Dr. Sankaran sir's description where they give about his entire anacardia family, active, passive. I'm not very much expert in that, but you can see the similar cord stiffness is there. He has mentioned very beautifully. And movement is not allowed is the reaction, and you are stuck and want to move. This is an opposite. So this is exactly opposite to this each. Can anybody tell me from which book I have taken this reference? Let's see who are alert. Everybody is alert. Like I'm talking more than 1.5 hours. We will be concluding in just 10 minutes. Can anybody tell me which is this book? Hello, everyone. Isha, how many participants are there, Dr. Isha?
51 over there here.
That's great.
And I think so everybody is, well aware. It's been very interesting.
Okay, thank you. So, so this is book from Kolkata's Dr. Banerjee. Very interesting book. The name is Classical Homeopathy for Impatient World. Classical Homeopathy for Impatient World. Okay, so you can see he has also beautifully given this is ritualistic, superstitious part here. I will mark it. Okay, this is a ritualistic part. Ritual is something who is doing same things again. Superstitious part, compulsory behavior. This is one part. Then again, dreams, roaming over the field. We have seen the video clip. Anxiety about children. Here you can see anxiety about children. Fear of being poisoned. This comes in later stages. So this Rustox, anacardium. Where anacardium is usually used? In a cases, advanced psychiatric case, bipolar disorder. Devil on one shoulder and angel on other shoulder. This is a psychiatric. So this remedy, being belonging to the same family of anacardiaceae as that of anacardium, has this kind of fear, poisonous, and psychiatric complaint also. You can use it in advanced psychiatric condition. Okay, just remember this. We don't see these cases often, but why it is there? Because it is related to the anacardium. That is the takeaway message. And what I have deeply highlighted here is has to be undercut wife of an alcoholic husband. Imagine a wife and alcoholic. He comes every day, torture her, beat her, no money. What will happen to my children? So all this scene typically fits to this Rustox, right? Yes, workaholic, caring, ideal housewife, similar to cocculus. We will see about cocculus and all also. Selflessly trying to exert herself for family. Typical housewife who eats last after everybody has eaten. There's, we bring something in the home, delicacies, sweets, mithais. Selfless is the one who takes last bite. Selfish is the one who takes the first bite. Rustox is the last one. Faced with financial worrying, overdoing herself, full of care and worries about others, children, future. Now see interesting part, menorrhagia from strain. Okay, again PV bleeding part coming here. Menorrhagia exertion after. So this is also I have taken the mobile version of this radar. Stocks. Okay. Anxiety about children. Okay, anxiety about their relatives. So those who have told causticum, they are also correct because it is coming close. Those who are told about cocculus, they are also very correct because it is coming to as also pulsatilla. So it is exactly in that jigsaw, it is in the same line, that group of remedy that we are missing. Again, I have done detailed differentiation. Many of you told about arsenic. The main is that arsenic is very censorious and criticizing. Let's go to the radar. Arsenic is the topmost remedy in censorious and criticizing. Censorious is someone who unnecessarily criticizes. Arsenic is for 3 mark. They are very harsh in the tone. Okay, then of course arsenic is selfish, related with his own health. Rustox is with the families. And then the restlessness, relief from pains, keeps on moving, restlessness from anxiety and fear. So arsenic is restlessness is from anxiety, Rustox restlessness from obviously pains. Better by motion in both, but they can't lie. For arsenic, anxiety is prominent. You see, anxious, fearful, restless mind. It is soft through the mind, but body is stiff. Okay. Now somebody has rightly pointed to cocculus. Cocculus is extremely close. The main point is that cocculus is dull, sluggish, slow to comprehend. There is neurological problem in the cocculus, like plumbum met. You pinch, it will take few seconds to realize, like that is cocculus. There are some remedies on the opposite. Slightest touch aggravate, slight touch. Which remedy has slight touch aggravation? Anyone? Okay, be attentive in the, so I will not feel that I'm talking to the, just screen. So there are the remedies. I'll show you. So it is exactly opposite to that. Okay, cocculus is exactly opposite to that. I'll show you in the radar. So generals, touch, slight. Okay, these are the remedies which are slight touch aggravation. Obviously cocculus, plumbum is not there, but belladonna. So these are exactly opposite. Cocculus, same sympathy, same empathy, same care, but Rustox, restless, active, doing work, exerting herself. Cocculus is dull, sluggish. The same one, dull, sluggish, exhausted, sleepy sometimes. This is those who has told about cocculus. In Rustox, complaint is overexertion, cocculus from caring, typically nursing the sick, weakness from nursing the sick. This is also beautiful rubric in the radar. Synthesis, not actual radar, synthesis. Weakness, nursing or something. Yes, nursing and staying up with the sick person. Can you see? This is a very beautiful rubric. I have used it a couple of times. A husband get paralyzed, for example, and wife has to look after him, not for days, not for months, years together. They don't have sleep. Now this is weakness, nursing, staying up with the sick person. Cocculus is the good mark. Okay. Bryonia, see, Bryonia and Rustox are couple that we are hearing from our college days. Now here is a precise differentiation. Both having things about money, but issues that this is very beautifully mentioned here. This differentiation made by Dr. Dhanashree, my wife. Business is the family. For them, family itself is the business. So they don't want, branded clothes, wealthy bags, cars. They want money for the family. On the contrary, Bryonia is more concerned about profit. So this is difference between the money mindedness. So Rustox always talks about business, but Bryonia actually talk about money. So if they miss a single day, they feel that if there is a Bryony Doctor, it is said, it is given in some of the mind videos, beautiful videos, that Bryony Doctor will not miss clinic because they will calculate, oh, if I miss this, so my money will be wasted. Okay, now this is my working time today and I'm taking lecture this. So if I'm Bryony, I might feel that, oh, my this 1,000 rupees has been wasted and like this. So they are very calculative. These are not someone who create a business empire, you know. Aurum is also businessman, but these are businessmen with a, see, to be a good businessman, typical, you know, businessman who has sense of vision, growth. This is a business. So these are some small businessmen who are daily concerned about their daily profit and loss, and that's why they are always irritated. These are businessmen of Bryonia, different from Rostox. Actually, why I have written, I have last month's case of the month was about Bryonia. So I have taken 2 sessions on this different platform, IFPH. So if you want to know more about Bryonia, I have taken in detail, especially in this part 2. Similar way, now we are doing Rostox. In the similar way, we have done for Bryonia. So I am taking very, very common remedies. As I have told in the initial part of this lecture, that I am not going for the rare remedies. This is something you can apply tomorrow. So please go for on this IFPH YouTube and you will find more about Bryonia. Okay. Now we are heading to our last part. Calcarea fluor is also money-minded remedy. But again, they are only, like Bryonia, they are only concerned with basic needs, and there is fluor component, which is more sexual side. Many of us has told about Calcarea carb. I have already told you the differentiation. Calcarea carb is inertia, obese, flabby, zerd, susta. Rostox, leaner, wiry, active. Another differentiation, you can take screenshot also if you need, but we have to go a little bit quickly. Carcinosin is very close, similar at the level of mind, but we need the remedy covering both active PV bleeding state and mind. Okay. Maybe this same lady, if she comes me with a later stage with some recurrence or some suspicion of CA cervix, you know, CA cervix or CA uterus, at that time I might think about carcinosin. Okay, because it is no so deep acting like medorinum, sorinum. It is altogether different weapon. Here the need is something that has pathologically producing PV bleeding, because it will cure PV bleeding at the same time matching this mind state. So carcinosin is being very close, not considered here. More rubrics, fear of being alone and all. Now some physical things, and we will conclude in 2 slides. It is Allen keynote. It is given in right side, but also it is given left to right progression. Start from left and go to the right progression. That you should remember, because the closest differentiating remedy sepia is right to left. So sepia, naxomica, hiparsulf, Rostox, arsenic, this comes everything close. Now here I would like to quote from my teacher. I have been to the student of Dr. 𝐑𝐚𝐡𝐮 sir since more than a decade and still attached to him. All my knowledge, if at all it is some way useful to you, is derived from Dr. 𝐑𝐚𝐡𝐮 sir. So he has written a very beautiful book, Thermal Mathemedica. From this Thermal Mathemedica, this is a conclusion that please don't overrule Rostox because patient looks something hot, because open air emulation is for 3 marks, right? Even there is a rubric in the mind that better in open air, 3 marks in the mind, like anxiety or something which is better in open, even in Kent repertory. Anxiety, let me check it. Emulation, yes, anxiety, open air emulation, Rostox is 3 marks. So thermal is altogether different topic. We have taken 1 2-hour session, or if Dr. Isha and Radar platform permits, we can take some time in future. But remember, this is not all chili. It is a dicey. It is an ambithermal remedy as per the analysis of Dr. 𝐑𝐚𝐡𝐮 sir. Now I will tell you quickly 2-liner 2 cases. Imagine you get a call. my wife has a peripartum cardiomyopathy. What is that? So there is a physiological cardiomyopathy in all pregnant women. In some pregnant women, it persists even after pregnancy. You get a call, no? Please give something for my wife. So how will you proceed on thinking? Detailed case is not possible. No, he is on call. So see the thought process. Why this happen in pregnancy? Because of the overexertion, right? Our heart has to overexert. Now the pathologically matching remedy in this case is Rustox. So we'll go to the radar. Chest hypertrophy of the heart from overexertion. See, you can see Rustox. You have Polycarp also, you have calcarea and all. Again, you have to ask few questions and you can help such patient. So pathology, Boger given by Boger is also a very important tool that you should not neglect, because it can, when both comes together, the results are really encouraging. Okay. Now we are to the second last slide. There was a very wealthy businessman. I practice in Pune also for 2 days, and Monday to Friday I'm in Satara. So I got a call from him. He's a very wealthy businessman. He's a multiple businesses, and he said that doctor, his family members are already my patient, but not this this businessman. So he said that I'm suffering badly from fever and dengue-like condition. Okay. Then in Marathi he said, Doctor, बघा काहीतरी कोंबडं बिंबडं कापा, काहीतरी म्हणजे माझी कुंडली बघा का असं होतंय. In English he said that, Doctor, please check my astrology, my stars, why this happening to me. Okay. So what this businessman told, Doctor, please see what bad with my my numbers, my kundli. This is the first sentence. Then I asked, what you want to do now? He said that now I want to get up and go to the dargah, which is in front of my hospital, because I have been hospitalized, and meet there and spend time there. This is the second sentence. Third sentence, I asked, how is your thermal alarm? He said that, no, I'm very much feeling cold. I'm with my covering also and taking sips of water. With this 4 rubrics, fear superstitious because of this sentence, like see my astro and all, religious affections, chilliness, thirst for small quantity of water, want to move, want to get up from the bed and go to the bed, not want to sit quietly in the bed. I again Rustox, and he was within just 24 hours, his all pains, weakness was over. He came to meet me in my Pune clinic after my subsequent visit, and still same patient. Okay. So fear superstitious, you can apply. So this is last slide of my today's presentation. So next time when you see any woman, any man, any personality who is very anxious about children, who is very busy, restless, who is very superstitious, religious, at the same time anxious about money loss, very much overstrain herself or himself, and sensitive to weather change, don't forget to think about Rustox. It is actually a selfless caregiver, exactly like our beautiful AI has created this, of course, with our prompts. Please take a screenshot of this. You can effectively. Okay, so this is all about my presentation. I hope Dr. Isha and everyone has learned from it. Please post your valuable opinion. These are the numbers of myself and Dr. Dhanashree. We run a WhatsApp group. You can part of this. You can take mobile number, and contact us. Thank you very much.
Thank you, Dr. Rahul. And it was a very insightful session, I believe, and all the attendees who were able to, witness this session live, they must be really thrilled and taking a lot from you today. And you are seriously very, it's the way you have been explaining, I do believe nobody will forget it. And Rustox would be something that will always come down if they picture such patient in their clinic. Adding to this, we will be having these case to remedy discussions very frequently with Dr. Rahul every month, and the next would be on 20th of December. So please stay tuned. all the information regarding that will be shared with the members as well as will be posted ahead. So you guys can register for the same, and we'll be looking forward for another session with Dr. Rahul soon.
Thank you very much. If you have some your feedbacks, please post on our that WhatsApp group. And thank you, Radar team. We have been conducting these sessions since more than 2 years, but we don't have this paid platform. After 45 minutes, our session used to close, and then we have to join again. But because of active moderator like you, we have enjoyed this session better. So thank you so much for you also.
All thanks to you, and it's been great being with you. Thanks a lot, Doctor. We'll be meeting you soon then.